Hey VC HHD students, my name's Andy. I'm a VC Health and Human Development teacher. In this short video, I'm going to look at answering the 2021 VC HHD exam, question number 12. Before we dive into question number 12, just a reminder at the Health Resources Hub YouTube channel, a new video like this is coming out each day between now and the HHD exam this year. You can subscribe with the button in the bottom corner of the video there. Please let your HHD friends know they can do so too. You can see our social media links there. If you'd like to get alerts to all of the new videos coming out each day, you can follow us, and also our email if you've got any questions or suggestions for videos you'd like me to work on. You can see here question 12 from the 2021 exams with 8 marks, and it started with some stimulus material about neglected tropical diseases. It said they're a key part of SDG 3, and that to end the epidemics of NTDs, the WHO has released a new global strategy that aims to achieve a 90% reduction by 2030 in people requiring interventions against NTDs, and to achieve this, action within and beyond the health sector will be needed. So A was asking you what are neglected tropical diseases for 2 marks. And so you had to say something along the lines of these were a collection of diseases that haven't had the number of resources and efforts directed towards them, like other particular health conditions, and that's why they're considered neglected. And you could have also said that they're more prevalent in tropical regions and are typically infectious or communicable diseases. So something along those lines would have gotten you 2 marks. You can see there a lot of students achieved 1 mark, but it was pretty difficult to achieve 2 marks for this particular question. B was then asking you to identify 2 SDGs that interrelate with the NTDs apart from SDG 3, and essentially you could have listed any of the other SDGs that we've studied in the course this year, and you would have achieved 2 marks for that particular question. But why it's important to read questions like this during reading time is because then C was asking you to use the SDGs identified in part B to explain why collaborative action is necessary to achieve the global target of a 90% reduction in NTDs by 2030 and to assist with achieving SDG 3, good health and well-being. So you had to choose, in B, a couple of SDGs that you felt confident then to answer C here, because these questions were linked. So you can see here this was a challenging question with only 4% of the state able to achieve 4 marks. But essentially what you had to do, is link each of your SDGs from the previous question to an aspect of SDG 3, but also talk about collaborative action. And so that's where you can talk about different sectors working together to achieve the SDGs. And so you can see they've given a high scoring response, which is worth reading. It mentions there by having collaborative actions where SDGs 3, 4 and 2 work together, they can help achieve the 90% reduction in NTDs by 2030, making sure that all children complete free, equitable, quality primary and secondary schooling, a key feature of SDG 4, quality education. Children in tropical climates can be taught the importance of how to prevent their risk of contracting NTDs and how to reduce spreading it to others, and this sees the education sector work in collaboration with the health sector to achieve SDG 3, good health and well-being, by reducing communicable diseases posed by NTDs. So that's obviously a link to a key feature of SDG 3 there. Additionally, by achieving SDG 2, zero hunger, ensuring all people have access to safe, nutritious food all year round, specifically the poor and those in vulnerable situations such as infants, can mean that people develop strong immune systems which can resist and fight off NTDs, and this therefore works to achieve SDG 3, good health and well-being, to once again reduce communicable diseases such as NTDs, as less people are contracting them with well-functioning immune systems. So you can see it was possible, to link in a couple of the SDGs into SDG 3, regarding communicable diseases, and also mention about collaborative actions such as different sectors working together. So that's definitely a question to go back and practice, because I think this is probably one of the more challenging types of questions you'd come across. Hopefully you found that useful. Just a reminder, Health Resource Hub YouTube channel, our social media links, and our email. Thanks so much.